So for my video health education topic, I chose heart failure. Today I'm going to discuss what is it, the causes, the signs and symptoms, and why, and what you can do. I chose this because this population was recently diagnosed with heart failure. I did a health literacy on these patients and they got a level 4. So they understood how to read labels and do math and read and can understand every piece of information that I give them in every piece of paper. So first we're going to discuss what heart failure is. Heart failure is your weakened heart. So it's your body depends on your heart's pumping action to deliver oxygen and nutrient-rich blood to the body cells. With heart failure, the weakened heart can't supply the cells with enough blood. So what causes that is common conditions such as coronary artery disease, high blood pressure, and previous heart attack, ultimately weakening the heart and causing this. I'm going to discuss with you the signs and symptoms of heart failure. So the signs and symptoms of heart failure, there's a lot of them, but these are the core ones that you recognize, and I'm going to tell you why they happen. So shortness of breath. So your breathlessness during activity, at rest, while sleeping, which may wake you up. You may have to prop yourself up with 2 or 3 pillows at night, or you often complain of being tired or feeling anxious or restless. Why this happens? Because the blood backs up into the pulmonary veins, the vessels that return blood from the lungs to the heart. Because the heart can't keep up with the supply, this causes fluid to leak into the lungs. Persistent coughing or wheezing, coughing that produces white or pink blood-tinged mucus. Fluid builds up into the lungs, the same kind of reason that I discussed with shortness of breath. Buildup of excess fluid in the body tissues, which is another major thing, and that's why I'm going to discuss what you should do in order to treat these symptoms is swelling in the feet, ankles, legs, or abdomen, or weight gain. You may even find that your shoes feel tight, or that it's harder to get your pants on that day. So why that happens is as the blood flows out of the heart, it slows, and the blood returning to the heart through the vein backs up. This causes fluid to build up in the tissues, and then the kidneys are less able to dispose of the sodium. And water, also causing fluid retention in the tissues. Another sign and symptom is tiredness and fatigue. So a tired feeling all the time and difficulty with everyday activities such as shopping, climbing stairs, carrying groceries, or walking. So the heart can't pump enough blood to meet the needs of the body tissues. The body diverts the blood away from the less vital organs, particularly muscles in the limbs, and it sends it to the heart and brain because they're more need of it than those muscles, and that's why you're so tired, fatigued, and can't carry all your groceries or even go grocery shopping. Lack of appetite, a feeling of being full or sick to your stomach, and the digestive system receives less blood, causing problems with digestion. So basically, when the heart is weakened, all that energy is taken towards your heart, and more focus is on it, and it's diverting from your other organs, causing issues like lack of appetite and tiredness. Confusion, impaired thinking, memory loss, and feelings of disorientation. A caregiver or relative may notice this first. You may not notice that because you just think sometimes you're confused, so sometimes I'm confused and I don't notice that either, so it's usually your family that will notice that first. And this is because of changing levels of certain substances in the blood, such as sodium, can cause confusion. And another sign and symptom of heart failure is increased heart rate. So heart palpitations, which feel like your heart is racing or throbbing, and that's to make up for the loss in pumping capacity. The heart beats faster. So those are signs and symptoms of heart failure, and those are also signs and symptoms when you're not treating your heart failure correctly, and you'll notice that. So I told you what heart failure was. I told you what causes it and the signs and symptoms and why. Now I'm going to tell you what you can do. So, heart failure is caused by the damage to the heart, and that develops over time. And that can't be cured, but it can be treated, which can improve your symptoms. So, I have a paper that I'm going to show you guys called Living with Heart Failure, and it's from Pocono Medical Center, and it's the 5 things to know. So there's 5 things you should know when you have heart failure, and the first is know your numbers. You should know your daily weight and your blood pressure. So you should keep a scale by your bed and step on it first thing when you wake up each morning, and then write it down. Be sure to tell your doctor if you have a weight gain of 1+ pounds in a day for more than 3 days in a row. So if you gained 3 pounds in 3 days, you need to let your doctor know. 3 or more pounds within 3 consecutive days. And your blood pressure should be checked at the same time each day and write it down. Tell your doctor if it is much higher or lower than normal, because that means that you might need your medications adjusted or something's wrong. So maybe I suggest weighing yourself and then checking your blood pressure in the morning or even throughout the day. The second thing you're going to do is eat smart, and you're going to limit your salt and fluid intake. I'm going to go into further with all of this, but this is just for now. So taking in too much fluid through drinking or eating extra salt can cause your body to hold fluid and make your heart work too hard. So you're going to read food labels for sodium content and don't add salt when you cook. Then swelling in your feet, ankles, legs, or stomach is a sign you are retaining fluid and you are having too much fluid and you need to lower your sodium and your salt. So you should limit your total daily sodium to 2,000 milligrams or 1 level of teaspoon. And usually around your fluid intake for a patient with heart failure is like 1,200 to 1,500 fluid limit, which is around like 48 ounces. And you should take your medications as prescribed. You should take your medications every day exactly as your doctor prescribed them. Don't stop your medications or miss your refills. Be sure to always talk with your healthcare provider first about missing them or not taking them or what their issues are causing. And be sure to watch how much fluid you drink when you're taking your pills, because you are on that fluid restriction. The 4th thing you should do is to prevent more damage by smoking cessation, by quitting smoking, and regular exercise. Prevent damage to your heart by quitting smoking. It can cause more damage than it already has done. Let your doctor know if you need help quitting, because we can provide help with that by numbers and groups and stuff like that. And reach and maintain a healthy weight with regular exercise. So the recommended exercise for a patient with heart failure is 30 minutes of cardio every day. So try and do that by walking, running, jogging, whatever you prefer. Yoga, up to you. And build up slowly when starting a new exercise program. So maybe you don't want to start off with 30 minutes because that's too much for you. Do a 15-minute walk and then work your way up to that 30 minutes. And recognize flare-ups. Keep all follow-up appointments and use the zone guide, which I'm going to discuss further in a few minutes, and follow your action plan to get help as early as possible. So have a plan in place of if you have flare-ups, what you're going to do, what doctor you're going to call, who you need for help, and your care team. So another good thing that Pocono Medical Center gave me was this, and it's a zone guide, and I'm going to discuss it with you guys. So a green zone means you're all clear. You have no shortness of breath, no weight gain, no swelling in the feet, ankles, legs, or stomach, and no chest pain. The action you're going to do is keep up the good work. This zone is your daily goal. This is what you want. This is how you should be doing this, and you should be following everything that I discussed earlier. The yellow zone. Get help now and call your doctor. A weight gain of 1+ pounds in a day for more than 3 to 4 days in a row. shortness of breath, swelling in the feet, ankles, legs, or stomach. New symptoms: feeling tired, no energy, dizziness, dry hacking cough, poor appetite, or fast heart rate. Are symptoms that you don't normally have, you should call your doctor. And it is harder to breathe when lying down, or you need to sleep upright in a chair, you should call that's the yellow zone, and you need to call your doctor. That's the action. Red zone is an emergency. So struggling to breathe or unrelieved shortness of breath while sitting still, no activity. You experience chest pain, or you experience confusion or cannot think clearly. Your action should be to call 911. So I have 3 prompts, and I want you to figure out which one is which person is in which zone. So I'm going to start with Bob. Bob has gained 5 pounds in the past 3 days. He reports feeling tired and says his feet feel swollen. And he slept in his chair last night because sleeping flat was too difficult. Then my second prompt is Amy. She's 75 years old and she takes her blood pressure every day and weighs herself daily, but has not gained weight in any of the 3 days. She feels good and takes her diet and exercise really seriously, and she recently quit smoking. What zone do you think she's in? And then there's Greg, and Greg has gained 10 pounds in the past 3 days and is struggling to breathe even at rest. He has chest pain and he is seriously confused. What zone is Greg in? So if you answered for Bob that he's in the yellow zone, then you answered correctly. Bob should call his doctor because he's gained 5 pounds, he's feeling tired, he's swollen, and it's hard for him to lay flat when he sleeps. So he should call his doctor and see what he should do next. For Amy, if you answered green, you then answered correctly. Amy is doing everything she should be doing because she exercises, she's taking her quitting smoking seriously, and she checks everything every day and is keeping up the good work. And then for Greg, if you answered the red zone, then you answered correctly because Greg should call 911 because he's struggling to breathe at rest. He's gained 10 pounds and he's seriously confused. So I thought that would be helpful in putting people into those perspectives and what zones they were in. So you want to make a goal towards your heart health for life. So you want to make sure your health is important and what you're working towards accomplishing. So I'm just going to go over that again. So you should weigh yourself every day before breakfast. You should limit your fluids, 6 cups or 50 ounces daily. You should check your blood pressure daily, read labels, and reduce daily sodium to no more than 2,000 milligrams. You should take all medications as prescribed. You should go for a walk, be active, and exercise every day. You should keep follow-up appointments with your healthcare team and make a plan for quitting smoking. If you're in the Pocono area, there's actually a number I can give you. It's 570-476-380. And you should monitor your heart failure zones and get help when you're outside the green zone. So like I said, Amy was in the green zone because she checked her blood pressure every day. She read labels. She was starting to quit smoking, and she was weighing herself every day. So she was all clear and keeping up the good work. So if you fall anywhere between that, you're gaining weight, you're gaining more than 3 pounds in 3 days, and you have shortness of breath and swelling, you should definitely call your doctor. So I thought this was good, this packet that Pocono gave me. It has like a log, and I'm going to give it to you guys, and it has the date, your weight, your AM blood glucose, your blood pressure, your pulse, your daily sodium, and daily fluid. And I think keeping track of that is just like really good because it keeps you accountable for what's going on with your health. And you just put your starting goal weight here. So it really does keep you accountable, which I think is good. So there's another thing that Pocono has on their thing, and it's for it's like your sodium and fluid, because that's very important, because if you retain too much fluid, it can make your heart work even harder, and then you'll get these symptoms that I was discussing in the yellow and red zone. So here it is. It says for breakfast, let me see if I could put it up closer for you guys to see. Okay, so it says for breakfast, I'm going to send you it too. For breakfast, I ate, and then you say the meal and how many milligrams of salt you have, and then how many ounces of fluid you drank for breakfast, and then for lunch, for dinner, and for snacks. And then you can add them up throughout the day to make sure that you're in the right zone. So it says that you want to use less than 2,000 milligrams of sodium per day to feel good. And if your heart works too hard with too much salt and fluid, which I already said. So don't use a salt shaker. Read your labels for sodium and reduce your fluids to 1,500 milliliters or 6 cups daily. So they say that you should have like 50 ounces of fluid. This right here is 16.9, so like 17. So less than 3 of these of fluid a day is recommended for someone like you with heart failure. And then for sodium, it's 2,000 milligrams. So I grabbed a can of Progresso to kind of help with that. And so the Progresso, if you read the label, it says it's two serving sizes, and the sodium in there is 670. So if you were to have this whole can of soup, which many patients do have this, because they don't know how to count their sodium, say that's 1,300, around 1,300, 1,340 to be exact, sodium, and you would only have 660 milligrams of sodium left, compared to this of cottage cheese, which of course is going to be way less. It was 360, and that's half a cup, the serving size. So I guess, yeah, wow. So, I mean, comparing these two, you can have many more of this than you can of this. You can only have 1 cup, and it's cutting one. You can literally have this whole can of soup, and you only have 660 grams left, which is another half of this soup. So 1.5 cups of soup of this a day of your sodium is recommended. So I'm going to tell you some foods that you can increase that are just have too much sodium, like don't have enough sodium, like you can have more sodium that day with them. So increase these foods like frozen vegetables, herbs and spices, homemade salads, dressings, and marinades. And fresh chicken, beef, or fish have less sodium than compared to canned vegetables, added salt from a shaker, store-bought salads, dressings, and marinades, and cured and processed meats. So you should just swap these. Instead of having the one canned vegetables, you should have the frozen vegetables. So with heart failure, you should, like I said, limit your sodium to 2,000 milligrams and keep that log and read your labels. And I taught you how to do that. And definitely limit your fluid to 48 fluid ounces a day. And that can keep you healthy for a while. If you do that, you won't exacerbate your symptoms and end up in these zones where you have to call your doctor or go to the hospital and exacerbate your symptoms. So today I discussed what heart failure is, what causes it, and the signs and symptoms and why you get those signs and symptoms. And lastly, to discuss what you can do. And I'm just going to reiterate some facts that I want you to take away from this that are the most important. And that is what you can do with this diagnosis that you newly have. Because your heart is an important organ and you need it to survive. So you should know your numbers. You should know your daily weight your blood pressure, and you should eat smart. Limit your salt and fluid intake. You should also take your medications as prescribed. You should take your medications every day and don't stop your medications or miss refills. And you should prevent more damage by smoking cessation and regular exercise. And you should recognize your flare-ups. You should know when you're not feeling right and you need to see a doctor or call 911. So what I also want to take away from this is these zones, because they're very important for you to know when you're doing well with treating your symptoms and staying in good health between not. So like I said, in the green zone, you're all clear. You have no shortness of breath, no weight gain, no swelling in the feet, ankles, legs, or stomach, and you have no chest pain. That means you are following all those 5 things that I told you to do to stay healthy. Now, you also could be following those and you could still get weight gain of 1+ pounds, shortness of breath, swelling in the feet, ankles, and legs or stomach. That means you need to call your doctor. These new symptoms are not normal, and you should call your healthcare provider immediately. And when you're struggling to breathe and you have chest pain and you confusion and cannot think, you should call 911 immediately. I wanted to choose this topic because you guys were all newly diagnosed with heart failure, and I'm comfortable discussing it. And if you have any questions, please let me know, and I will answer them for you. Thank you.